Why do so many chronic patients feel stuck in a love-hate relationship with their doctors? You rely on them for answers, yet each visit can leave you more frustrated than the last. Here's the thing, nobody's really at fault. It's a system that struggles to deal with the complexity of chronic illness, and the result? A cycle of hope, disappointment, and mistrust. Let's break down the typical journey of a chronic pain patient. Picture this. It starts with a dull ache or constant fatigue. At first, you brush it off, thinking it'll go away. But weeks turn into months, and the symptoms don't disappear. Eventually, you book that first doctor's appointment, hoping for answers. The doctor listens, runs some tests, prescribes a treatment, and sends you home. You feel a spark of optimism, but nothing changes. The pain stays, maybe even worsens. So, you go back again and again, each time more frustrated, more desperate for answers. Meanwhile, the doctor is following protocol. Pain and fatigue are such broad symptoms, linked to hundreds of conditions. Without a clear diagnostic marker, they're working methodically, ruling out possibilities one step at a time. But for you, it feels painfully slow. For chronic patients, the wait is agonizing. Every test feels like another dead end. Every treatment feels like a shot in the dark. And with no clear answers, that small spark of hope starts to flicker out. For doctors, it's no easier. Chronic illnesses like chronic fatigue syndrome, fibromyalgia, or autoimmune disorders often don't show up on standard tests. It's like solving a puzzle where half the pieces are missing. And then, there's the misdiagnosis trap. Sometimes, unrelated anomalies in test results lead to treatments that don't actually address the root cause. You're stuck in a cycle of incorrect answers, feeling like no one's listening, or worse, like they don't believe you. And here's the paradox. Despite the frustration, chronic patients are often the most informed about their conditions. You've read every study, joined every online support group, and maybe even tried alternative therapies. You want to trust the system, but it's hard to ignore how often you feel let down by it. Doctors, on the other hand, are doing their best within a system that isn't designed for chronic conditions. They're trained to treat acute illnesses, things they can see, measure, and fix. Chronic illnesses, with their invisible symptoms and unpredictable patterns, fall outside those lines. Patients want relief, doctors want to provide it. But without the right tools, the journey becomes a maze of missed connections. At the end of the day, both sides want the same thing: answers, understanding, and relief.